So now we had seen about male genital system. Next we'll move on to female genital system. So in female genital system, we'll be discussing about rhabdomyosarcoma, then human papilloma virus, cervical cancer and pap smear, then endometriosis and adenomyosis, endometrial hyperplasia and cancers, then leiomyoma, then the various ovarian tumors and gestational trophoblastic diseases. So out of this, in the previous year question also, there was a question related to pap smear and cervical cancer. So we can expect some other question related to that again in this year also. So let's start with rhabdomyosarcoma. This usually presents in the genital system in the vagina. Okay. So rhabdomyosarcoma. So it is a mesenchymal malignancy. Rhabdomyo. So myo refers for muscle and rhabdo refers to the skeletal muscle. So it is going to be a skeletal muscle tumor. Usually in the female genital tract, it is going to present in less than 5-year-old child. So in less than 5-year-old child, they can give you a history of a mass protruding through the vagina. So this mass is going to appear grape-like. So this kind of an image. So grape-like cluster of mass is going to be present, which is protruding from the vagina. And that is why it is given the other name as sarcoma botryoides. Sarcoma botryoides. It is going to be a embryonal carcinoma. So the embryonal variant of rhabdomyosarcoma. Okay. We have embryonal variants of rhabdomyosarcoma. Under this, the sarcoma botryoides is going to be of the embryonal variant. On immunohistochemistry, any of the rhabdomyosarcomas, so anywhere in the body you can get rhabdomyosarcoma. So it is going to be positive for Desmond, which is a muscle marker. Then specifically for skeletal muscle, we can use MyoD1 or myogenin. So both of this is going to be specific for skeletal muscle. So all three markers can come positive in rhabdomyosarcoma. Again, rhabdomyosarcoma not just in vagina. Some question related to rhabdomyosarcoma and the IHC was given. So it was given as Desmond positive. So that question was asked in the previous NEET. Okay. So they are concentrating on the immunohistochemical markers nowadays. So for any tumor, you read the IHC markers along with it. So microscopically, how does this sarcoma botryoides look like? So it can affect any of the mucosa, usually in the nose, in the vagina, in the bladder. These are common mucosal sites wherein you can see a rhabdomyosarcoma. So whenever it occurs in the mucosa, the tumor cells are going to appear as a layer beneath the normal mucosa. Here, this is going to be the normal mucosa. And beneath it, you are seeing the tumor cells which are arranged as a layer. And this layer is going to be called as cambium layer. So cambium layer is seen in rhabdomyosarcoma, that is sarcoma botryoides. And the microscopic image of these cells is going to be strap cells. So these kind of cells which appear like some pyramidal shaped kind of cells, right? So these cells which have this kind of an appearance, they have some striations in their cytoplasm. These are called as strap cells, and these striations actually represent their skeletal muscle origin. So skeletal muscle is a striated muscle, right? So since rhabdomyosarcoma is it's arising from the skeletal muscle, these also have the cytoplasmic striations. And since these strap cells have this elongated shape of appearance, like a flame shell it is appearing. So it is also given another name called as tennis racket cells. So tennis racket cells are also called as strap cells, and these are seen in rhabdomyosarcomas. So don't confuse it with tennis racket appearance. Okay, tennis racket appearance is different from tennis racket cells. Tennis racket appearance, we see it in Langerhans cell histiocytosis. So Langerhans cell histiocytosis was a histiocytosis lesion, right? So in that you are going to have Birbeck granules. So Birbeck granules will be present in the Langerhans cells, and they'll have this tennis racket appearance, which we see it on electron microscopy. Okay. So that is different. So tennis racket cells are present in rhabdomyosarcoma.